Minister, the public dental health services is in crisis. There is a shortage of dentists also in the private sector, and this is due to a lack of planning and the schemes not being properly resourced. Dental and oral health have not been made the priority that they need to be. For a relatively wealthy first world country, we have a third world dental health system. Untreated tooth decay is one of the most common health conditions according to the Global Burden of Disease Report 2019. Conditions such as stomach ulcers, gum disease, heart condition and a range of other physical health issues are caused and can be caused by poor oral health. The workforce crisis in dentistry has been well publicised over recent years, and it hasn't happened all of a sudden. This has crept up over a number of years. But action on this by successive governments and the HSE has been way too slow and not near the pace required to have a substantial impact. And in recent years, there's been not enough attention or resources put into prevention through education and public awareness campaigns. The cure, Minister, comes too late, often in the form, and most likely in the form, of multiple extractions and fillings. And I want to address the main public schemes: the school dental scheme, the dental treatment services scheme, the treatment benefit scheme, and indeed orthodontic, where there is a 6-year, imagine a 6-year waiting list for treatment for orthodontics. The school dental scheme is not providing timely and adequate treatment for primary and secondary school pupils. Children are not being seen for their first examination in 2nd, 4th and 6th class as they should be. And in many cases, they're receiving their first examination in secondary school and well into it. In Laois, that's in 4th year. They're 4 years in secondary school when they're being seen first. In Offaly, it's much better, 3 years, and that is an absolute scandal in public health. In the case of Laois, according to HSE figures, 6,433 pupils are waiting on their first examination. And as I said, for most of those, that will come 6 or 7 years too late. And then they have to wait for treatment. In 2017, 135,662 pupils were screened and treated, and this dropped to 101,112 in 2023. So we're going backwards. In the same period in Laois, and I'm not too sure what happened here, and this is based in Laois Offaly, this is based on the figures I got from the HSE, it reduced from 4,300 in 2017 to 181 in 2023. And that's an interesting figure. The dental treatment services scheme for adults and medical cards is not available in many areas. In Laois, for example, only one dental practice, and that's based in Carlow, on the edge of Carlow town, is currently taking clients under the scheme. The budget for the scheme, for the current scheme, is 73 million this year. That's a reduction of 6 million on 2010. And there has been a reduction of almost 50% in the number of dental practices taking clients under that medical card scheme. The HSE Emergency Dental Health Services is almost impossible to access. The treatment benefit scheme, which is based on PRSI for workers and retired workers, only provides for examination and cleaning. And this puts lower and middle income families at a disadvantage. I'm thinking here about a lot of ordinary workers and their families. Get no fillings and no extractions under it. And overall, Minister, 83% of dental treatment is funded by out-of-pocket payments. And children with special needs and adults that are required to be have anaesthetic to access treatment, they suffer from a lack of services, and there's a 2-year waiting list in hospitals for that. They're often presented, and I've had cases to my constituency office about it, where they present with serious levels of tooth decay and oral health issues, and that needs a fix. In the Dublin Midland Health Region, there are 654 children on waiting lists for that hospital treatment, and in the case of adults, 102. That needs urgent attention. The Irish Dental Association highlighted that 500 additional dentists are needed immediately to address the crisis, both in private practice and in the public services. With a rising population and a high number of dentists who are going to reach retirement in the coming years, this needs a particular focus and action from government. To underline the scale of the crisis, the overall number of dentists working in both public and private practice has dropped by 23% in the last 15 years. Only 10% or less of dentists are working in the public services. It's estimated that 120 additional dentists are needed just to maintain the very, very basic level of services that we have at the moment. In 2023, 320 dentists were working in the public services. In 2025, that's down to 294 according to the HSE. In private practice, the Irish Dental Association state that due to workload, a quarter of dental practices will not take on new adult clients, and more than a third will not take on children. It's not because they don't want to, they can't because of workload. And while the effects of all this are across society, low and middle income households are hit the hardest. Between 2009 and 2023, there was an €800 million cut in funding for the PRSI and the treatment benefit schemes. That's the medical card scheme I referred to earlier. And this has meant, workers on those low and middle incomes, they've had huge negative outcomes. And unfortunately, dental health and dental treatment is often put on the back burner by families out of economic necessity. And it's so important, and you understand this, it's so important that this is tackled early when they're in primary school, in second class. I would also say to you we need to bring forward the promise scheme for under sevens, but an €800 million drop in funding for those two public schemes over a 14-year period has had a significant hit. So I'm asking that the government publish the long-promised new plan for dental services. I acknowledge there was a new dental school opened last week in Sandymount. The Minister for Health told me about this the other evening. I acknowledge that, but more needs to be done. But we need to bring forward a plan for dental health services, a scheme for under sevens that needs to be given priority, provide for a significant increase in the school dental places in universities, and particularly in UCC and TCD, to provide additional funding for this. We need to facilitate the reintroduction of a structured mentorship programme to allow new graduates to gain work experience, and you understand the importance of that. We need to authorise the HSE to step up recruitment for dentists to work in the school dental scheme and the public dental services. And we need to sort out the delay between dentists, the point where dentists are recruited and told that they have a position and actually start work. Because my information that I'm getting, if it's correct, is that can be 6 months plus, Minister, and that's too long. And what's happening, and the officials need to take this on board and take it up with the HSE as well directly, is that delay in the interim period, they emigrate or they get another job. That means we don't have them in the public sector where we need them at the moment. You need to introduce a very dynamic advertisement and recruitment campaign for the dental treatment services scheme. I know extra funding was provided for that and the rates being paid has been increased, but we need to encourage more dental practices to take on medical care patients in all parts of the state. And Laois, I've highlighted this before here in this House. I've been at this since Leo Varadkar and indeed James O'Reilly was Minister for Health. This needs to be sorted out. It's bad across the country, but there's a big hole in it in Laois, and Offaly isn't much better. We need to expand the range of services available under the treatment benefit scheme. Workers are working hard, they're paying tax, it's gone out of their wages before they get them, the PAYE, the Universal Social Charge, the PRSI, and people don't mind paying it. But we need to see services for that. And if people could see good services, they won't mind paying the taxes and the levies like that. We need to ensure that the HSE improve and expand the hospital services and capacity for those children and adults with special needs and that require the treatment. I've outlined the numbers waiting just in one area alone, and that needs to be tackled, Minister, because there's a particular need there because they have to be under anaesthetic before they have the treatment. So, and we're coming up to budget time and you're being lobbied left, right and centre. I can see the lobbyists coming in now here every day, and sure, they're coming to us as well as opposition TDs. But what I'm saying to you is this area needs, it's not just about oral health. Oral health affects all health. You need to provide a significant increase. And the one message I want to leave you with, from being chair of the Public Accounts Committee for 4.5 years, there needs to be a clear tracking done between the budget going in, because if you just throw money at it, you won't get the outcomes. There needs to be clear tracking between the budget going in and the outcomes and the services provided. That needs to correspond with the increase in budget.
Thank you. Thank you.